Welcome back to our regular podcast series. Currently, we are discussing male cancers. Last week, we explored the topic of male breast cancer, which, although rare, can and does happen. Today, we look at testicular cancer, which, according to the National Cancer Registry in South Africa, typically affects men aged between 15 to 40 years of age. Although testicular cancer accounts for only about 1% of all cancer cases in men, it is important to recognize the early signs because this particular cancer is highly treatable and the chances of recovery are excellent if it is caught and treated early. So, what are some of the risk factors according to the American Cancer Society? We've already mentioned age. Testicular cancer usually develops in men under the age of 40. But other risk factors for developing the disease include men with a family history, men who have had a previous occurrence, undescended testes at birth, HIV infection, and lastly, race. White men are 4 to 5 times more likely to suffer from this particular cancer than any other race group. That said, what are the symptoms to look out for? A lump or swelling in one or both testicles, coupled with a feeling of heaviness or aching in the scrotum or lower abdomen, and a dull ache in the lower abdomen or back. These are usually the first indicators, but other symptoms could include a change in size and shape of one testicle, dull ache or feeling of pressure in the lower abdomen or scrotum, feeling of fullness or heaviness in the scrotum. Also, look out for a sudden collection of fluid in the scrotum. So, how can men catch testicular cancer early? The easiest way is through testicular self-examination once a month, which medical professionals recommend should begin soon after puberty. This should preferably be done after a bath or shower to feel for any pea-sized lumps that could indicate testicular cancer. If you experience any of these symptoms, see your doctor immediately, who will conduct a physical examination, run blood tests, possibly even imaging tests such as an ultrasound or CT scan. As for treatment, the most common treatment is surgery to remove the affected testicle, but it could also include radiation or chemotherapy. Upon completion of the treatment, and this is very important, a team of doctors and specialists will follow the patient to ensure the cancer does not return. Of course, the possible financial implications of all of this are massive. So taking out a dedicated cancer cover is advised. Insurance providers like TRA are coming up with inexpensive ways to provide financial security. Take, for example, their female cancer cover product, which makes provision for the male spouse to qualify for cancer cover for testicular, penile, male breast, bladder, and prostate cancer from as little as 75 Rand a month. I strongly urge you to look into this, as easing the financial burden associated with cancer treatment can alleviate the emotional stress of being diagnosed with this dread disease. In parting, know your risks, stay vigilant, and recognize the possible signs of the disease. This still remains the best protection of all.